My name is Dr. Grace Chingo. I'm a pediatrician by profession from Lusaka, Zambia. I am currently undergoing training under Pediatric and Medical Oncology at Dr. Borooah Cancer Institute in Guwahati, Assam.
I'm Dr. Charles Kapela Mwandama. I'm from Zambia. By training, I'm a physician in internal medicine. So I'm here at Borooah Cancer Institute, enrolled to do a adult Haemato-oncology training.
I'm Dr. Swali Vusa Fundafunda from Lusaka, Zambia, a trained obstetrician gynecologist, and I recently finished a training in gynecological oncology at Dr. Borooah Cancer Institute here in Assam, India.
So in terms of challenges that we have back home in Zambia, we have a population of about 18 million. So when it comes to trained expertise in terms of doctors that are trained in cancer management, like oncologists and other paramedics like nurses, nutritionists, palliative care, our numbers are quite few. Like currently in Zambia, we don't have a trained physician like myself who's trained in Haemato-oncology.
The other thing is that because of the few trained gynecological oncologists in the country, diagnosis of these cancer cases is not enhanced, and most patients are treated as benign conditions for a long time before somebody gets to make a diagnosis of a cancer in them.
And what we've noticed, the patients that come to Cancer Disease Hospital are those patients that are within the vicinity of Lusaka province, meaning the rest of Zambia are really not catered for. And in addition, most of these patients, by the time they are presenting to CDH, they are in advanced stage of the disease. As I was coming for this program, my expectations were to be exposed to the common pediatric cancer patients, be able to see patients, how they present, be able to work them up in terms of diagnostics, come up with a treatment plan, know what type of, how to approach a type of patients and what type of chemo you're supposed to give, how to administer chemo, as well as the common medical oncology procedures.
I also expected that at the end of this program, I would have seen as many patients as possible in terms of according to my area of study, so that when I go back home, I would have encountered in physicality all the major hematological conditions, the one that I read up in textbooks. So that this will at least will capacitate me to manage the patients with confidence when they get back home.
This place, I should say, has afforded me good exposure in surgical exposure in gynecological surgery, and even because of the fact that they have diagnostic equipment that is usually readily within reach of the patients. I've been able to make a diagnostic plan, investigate the patient, and come up with a universal treatment plan for gynecological cancers.
Apart from being exposed to how to manage these patients, I had an opportunity to be exposed to a holistic approach in terms of pediatric cancer care. Apart from having nurses, doctors on the unit, the dietitian or nutritionist is very important in terms of delivering quality care to pediatric cancer patients.
This training was a hands-on training. I had an opportunity to interact with newly diagnosed cancer patients at the time of their first presentation. I was able to clock them, get a physical history, do a physical exam, and I was able to risk stratify the patient based on the presentations. Then I was also able to design investigations required to come up with a diagnosis. After that, I had an opportunity to interact with our professors, our lecturers, to design a treatment protocol or a treatment program for the particular patients. Then we also had an opportunity to follow up the patient after commencement of of the treatment. Yeah, but the challenges came in when the COVID-19 came onto the scene. It meant that we had to reduce the interaction with the patients to avoid catching the infection. So even doing the physical exam, we had to minimize physical examination to just the relevant aspects.
However, this was compensated through webinars and Zoom lectures. We're able to continue learning through internet. So
oncology is a very diverse topic, and having this training in 1 year is, I wouldn't say very short, but it's quite short for someone who is going to be a specialist in this field. So to the would-be trainees, I would suggest that as they come for this program, once they start with a bang. They start reading. The interaction with the consultants and their colleagues should be very enhanced, so that they make use of every second that they spend while in training. That would help make up for the reduced time in training.
In terms of how the program can be improved, I would recommend that since most of the locals, meaning the patients, speak the local language, it would be helpful if the trainees are exposed to language learning concurrently with the training for at least the first 4 weeks.
So if I was to be asked 2 important things that my Minister of Health back home can concentrate on to improve cancer care. So basically break it down to cancer awareness as one. In cancer awareness, I would want us to improve education, especially to both the patients and the care providers, on cancer prevention and early signs and symptoms of cancer. Because what we normally get at my hospital is patients are referred quite late.
Then the other issue is in terms of human resource. We have very few specialists available in the country to offer quality care to these pediatric cancer patients. I would like to thank Merck Foundation and Tata Memorial Center, specifically Dr. Borooah Cancer Institute, for according us this opportunity to have exposure, acquire knowledge and skills, to be better equipped to deliver specialist cancer care back home in Zambia. We are definite that the exposure that we've had will have a lasting impact in terms of delivering better quality health care services for pediatric cancer patients in Lusaka, Zambia.
Finally, I would like to thank Merck Foundation, Tata Memorial Center, and BBCI for the training and for the hospitality that was given throughout the year, and the people of Assam.